All right, let's jump right in. We're going to talk about a smarter, much faster way to think about these really complex autoimmune conditions. Think of this as your high-impact preview for not just acing your nursing exams, but for building that real confidence you need in clinical practice.
And you know that's the scariest part, isn't it? These conditions are so sneaky. What might look like just being tired or a simple ache could actually be the very first sign of a huge storm brewing inside the body.
Now, this is the million-dollar question for every single nursing student. And let's be real, getting this right isn't just about passing a test. It's about keeping your patient safe and preventing some serious, long-term, irreversible damage.
Okay, let's just be honest with each other for a second. This topic can feel completely overwhelming. There is so much information and so many of the symptoms seem to overlap. It's no wonder so many students find this stuff really, really tough.
Do any of these hit a little too close to home? You spend hours, maybe days, memorizing every single lab value and symptom, but then you get an exam question that throws a real-world scenario at you, and suddenly it's all just a jumbled mess. See, the key isn't just to memorize the facts, it's about learning to see the patterns, and that is exactly what we teach inside the CSMRN framework.
All right, let's start building our first pattern. We're going to focus on how to recognize when the immune system's attack is zeroed in, localized, right to the joints.
And here's our classic example, rheumatoid arthritis. With RA, the immune system is definitely in overdrive, but its main battleground is the joints. That's what causes that classic inflammation, that deep pain, and that awful stiffness.
Okay, I want you to picture this patient right now. They've got swollen, tender joints, not just one, but in multiple spots. And they have that telltale morning stiffness. What's the first thing that should be popping into your head?
This right here is a perfect example of pattern recognition in action. When you see that very specific combo, the localized joint pain plus that really bad morning stiffness, which happens because all those inflammatory chemicals pool in the joints overnight, your brain should immediately light up with rheumatoid arthritis. It's a simple, reliable formula.
Okay, great. But what happens when the attack isn't just in the joints? What happens when it goes systemic? Let's take a look at what it looks like when the immune system decides to target the entire body.
Now, this slide is absolutely crucial because it lays out the differences so clearly. For RA, we said the primary target is the joints. But for SLE, or lupus, the immune system goes after connective tissue everywhere, the skin, the joints, and here's the kicker, the major organs. And that's exactly why the symptom list for lupus is so much longer and broader. It's a signal of a massive body-wide fight. And this is exactly why telling them apart is so critical. Look, an RA flare might mean really bad joint pain, for sure. But an SLE flare, that could mean the immune system is actively attacking the kidneys, the lungs, or even the heart. The stakes are just completely different. Okay, on to the next scenario. Your patient still has joint pain, but now we're adding two huge new clues to the puzzle. A classic butterfly-shaped rash on their face, and proteinuria, that's protein in the urine, which is a big red flag for kidney trouble. So what is this new cluster of symptoms telling you? Yup, you got it. This is our systemic pattern. The second you see symptoms from completely different body systems, like the musculoskeletal system, the skin, and the renal system, that is a massive clue pointing straight to SLE. We're not just talking about joints anymore. We are talking about the whole system. So recognizing the right pattern, that's step one. But the really crucial next step is letting that pattern guide what you do next. It has to guide your nursing priorities. Because a different diagnosis means a totally different game plan.
Just look at the difference here. For our RA patient, we're all about managing pain and trying to preserve their mobility. Think physical therapy, heat packs. But for our SLE patient, our priorities just shift dramatically. Now we're focused on managing those big, systemic flares, actively protecting their vital organs, and teaching them how to avoid triggers like sun exposure.
Okay, let's raise the stakes one more time. Your patient has a known diagnosis of lupus. They call you, or they're in their room, and they suddenly say they can't catch their breath. In that exact moment, what is the number one thing you need to be concerned about?
Your immediate priority, without a doubt, has to be assessing for a life-threatening complication. With SLE, you can never ever assume that shortness of breath is just a minor thing. It could very well be an acute flare that's attacking the lungs. Your quick assessment could literally be the thing that prevents a catastrophic event.
So this entire way of thinking, the pattern recognition we talked about, the risk assessment, the prioritization,
All of that is the foundation of the CSMRN framework. It's specifically designed to build this exact type of clinical judgment.
And it boils down to a really simple three-step formula. First, you recognize the pattern. Is it local or is it systemic? Second, you interpret what that pattern means for organ risk. And third, you prioritize your actions to protect your patient. It's a clear, repeatable process that you can use every single time.
And really, this is the heart of it all. This isn't about just memorizing endless lists of facts. It's about building the real clinical judgment you need to see the risk coming and step in to do something about it.
Because at the end of the day, that's what matters. Whether you're sitting in an exam or you're standing at the bedside, being able to recognize these patterns quickly and accurately is what protects your patients and prevents that devastating long-term harm.
So everything you've seen here today, this was just a preview. The full, complete framework that will help you master this kind of structured clinical reasoning for your exams and for your future patients, it's all waiting for you inside.